So you've learned a lot about the knots themselves, the wounds and whatnot. You've learned a lot about surgical skills, and now we're moving on to the alternates of sutures. So you have a wound, you have to tie it, but you're not going to use sutures. We'll see what these alternates are. These are the advancements in medicine, and they're happening quite rapidly. The ones we are going to talk about include the skin adhesive tapes, the tissue glue, the laparoscopic wound closure, then the staples, and finally the stapling devices. So starting off first of all with skin adhesive tapes. Here you can see in the figure, this is the adhesive tape being applied on the skin. So it is applied when the wound is clear, small, clean. There's not a lot of moisture. With the help of these tapes, you can easily view the wound without cross-contaminating the wound itself. So it is used on skin where there is no tension. We've talked about it, and not too much moisture. Again, we've talked about it. They cause minimal scarring. Now these are transparent dressings, as we've talked about, and they allow wound inspection without cross-contamination. And examples include off-site dressing. Now tissue glue, this is the tissue glue. Now they are based on butyl to cyanoacrylate polymer, and this monomer is used, while some of these tissue glue substances have fibrin within them. So what they actually do? They form adhesive bonds on the wound themselves. They are actually pretty expensive, but they act pretty fast. So they are very helpful in roadside accidents and traumas to control the bleeding that might be occurring. So the fibrin types, they're commonly used to control the GI hemorrhage endoscopically. So the important aspect of this is, if there's a GI hemorrhage endoscopically, the fibrin type of tissue glue is commonly used. Now moving on to the laparoscopic techniques of wound closure. So the laparoscopic technique closes a wound. The length of the wound might be 3 to 12 millimeter. Now the wound should always be parallel to the Langer lines. We've talked about it before. Being parallel to the Langer lines, it heals with a lesser scar and heals easily. Now the skin closure can either be carried out with the help of the sutures, with the help of the needles, with the help of glue, or the adhesive tapes. So in the laparoscopic realm, the wound is actually a small wound and can be closed by either any of the traditional or the newer methods available. Now skin staples, these are the mechanical methods. These are linear side to side. Here you can see this is a side to side closure. They are both used in open surgical procedures and the laparoscopic procedures. Now these are disposable and these are relatively expensive, but the cost is offset because they can easily be applied. They are rapid to apply. They can be applied in areas where you cannot suture properly. So the cost, despite being slightly costly, it is offset. So what are the various stapling devices? So in GI tract, the stapling devices tend to apply 2 layers of staples or 2 rows of staples. These are produced in relation to each other to produce a sound anastomosis. So let's see how that happens. So the type of devices employed are used to perform an end-to-end anastomosis, a transverse anastomosis. Now an end-to-end anastomosis is when 2 tubes are being joined from their ends. Now a transverse anastomosis can occur also. Then we have intraluminal anastomosis occurring within the lumen itself. And there can be other devices that are being used, amalgamation of some of these devices or the newer techniques. Let's talk about end-to-end anastomosis now. So these are 2 these are 2 tubes, the end of 2 tubes that are being brought together. So there's end-to-end anastomosis here. So in end-to-end anastomosis, this is the circular stapling device. Here you can see Now, it is used in the esophagus and the lower rectum. So now the inserting detached head is entered in through one of the ends. It can be either end of the bowel or the end of the esophagus. Now, the device is then inserted into the other end of the bowel. So you insert one end of the device on one side of the tube and the other end to the other side of the tube. Now, via rectum or enterotomy, the shaft is extended or secured. Now you extend the shaft and you connect both the ends that were in different tubes. Now the head is reattached to the shaft, as I've talked about earlier. Now the green indicator shows that the device is now fully closed. So a fully closed device is indicated by a green indicator, and when that green indicator button is active, you fire your device, and this assesses the integrity of your anastomosis. Now, when you fire this device, it throws 2 rows of staples, and this 2 rows of staples anastomose your upper esophagus, lower esophagus, upper esophagus, or lower rectum. So this is how an end-to-end anastomosis is produced with the help of these devices. Now moving on to a transverse anastomosis. Here you can see this is a transverse anastomosis, and this is the device being used for the transverse anastomosis. So transverse anastomosis is between different sizes, and still it provides 2 rows similar to the end-to-end anastomosis, and these 2 rows help secure the anastomosis itself. Now it is useful for closing the bowel ends and create gastric tubes and partitioning. So when various ends of the bowel have to be united with each other because a greater portion of the bowel has been resected, so this is where the transverse anastomosis and these devices come in. Now they're useful in the pelvis, but they have to be used with a movable head, which is known as a roticulator. So a roticulator can be used in the pelvis because they can be used in the pelvis with the help of a roticulator. Now division of the bowel is done before the instrument is reopened because you cannot division it afterwards. Now it contains a ridge along which you can pass the scalpel, and this ridge is useful for the division of the bowel. The reason for this ridge to be there is for you to pass the scalpel and with that to divide the bowel. So importance is that you have to divide the bowel before you reopen the instrument. Now, lastly, we have the intraluminal anastomosis occurring within the lumen. So here you have inserted the device within the lumen, and now you're producing the anastomosis here. So let's see how that goes. So it has 2 detachable limbs. Each limb is inserted in the loop of a bowel, similar to end-to-end anastomosis. Now the limbs are resected and the device is closed. So finally the limbs are resected and the device is closed, and this brings the 2 ends of the bowel together. The 2 rows of staples are inserted either on either side of the bowel, or either side of the bowel gets the staples, and it's used in fashioning a gastrojejunostomy or duodenostomy. So with the help of this, you can either perform a gastrojejunostomy or duodenostomy, commonly done during the hepatic surgeries. So it can also be used in ileal pouch formation. So these are some of the uses of intraluminal anastomosis. So what are the other devices? Other devices, we have devices that will staple and divide blood vessels. Then we have handheld stapling devices which are used for skin closure. And in the figure you can see this is a stapling device. This is being used endoscopic laparoscopically. Then we have handheld stapling devices used to close skin, very commonly used. And in all of these devices, usually you can load the staples and you can actually fire them again and again. Initially it was you had to load this one staple, then you had to fire that, then load another. But now there's no individual picking up of staples. You can fire multiple staples at the same time. So talking of the laparoscopic stapling devices, which was seen in the previous figure, the intestinal stapling devices are very important. They are inserted down the trocars during the laparoscopic surgery. So this is what they look like. This is a laparoscopic stapling device, and they're used in gastric procedure. This is a gastric sleeve procedure, a bariatric surgery, and this is how the device has been used. So in order to use this device, it's very simple. You just have to insert the device through the trocar and then you can use it. The principle and function is similar to the open surgical procedure or the surgical equivalent. They are very nice, very effective in maintaining the homeostasis. So now we also have the linear cutting staplers. Here you can see in the figure, this is a linear cutting stapler. The linear cutting stapler is like an intestinal stapling device. It is help in sealing of bowels and vessels. It is used in a similar procedure where you have to insert it through a trocar and you can perform whatever surgical procedure is required. We also have open staplers. Open staplers are commonly used for the closure of skin. These are the handheld staplers which are commonly available in your emergency room, and they help in providing the stapling to the skin. So the stapling devices are actually the mechanical devices. They work in unison with the principles of the stapling devices and are commonly used in the emergency department, the endoscopic surgery, and the open surgical procedures. So this was all about this section. In this section, you learned about the alternates to suturing, the newer techniques. These techniques are being developed daily, so you need to read up on these techniques whenever you can. I hope you liked and enjoyed this lecture. For further such lectures, keep watching sqadia.com.